Uh, Good morning to everyone. I'm Surgeon Lieutenant Commander Yasita Veerasinghe, and it's indeed a great pleasure to present in this scientific session, which talks about diving safety in this symposium. So I will be talking on quite an underreported but a relatively common problem in diving, which is also can be fatal if undiagnosed, which is carbon monoxide poisoning. So another reason for choosing this topic is, as you may know, the treatment of choice for carbon monoxide poisoning is the use of hyperbaric oxygen therapy, which is used by the divers to treat the ailments or any sicknesses caused by diving. So this hyperbaric oxygen therapy is similarly used for carbon monoxide poisoning to treat carbon monoxide poisoning. So this can be done in Sri Lanka, but only at Trincomalee dockyard, which the hyperbaric chamber facility is available. So we'll see what is carbon monoxide. So if we get a little insight about the gas carbon monoxide, it is produced through combustion reactions and burning of some fuels. So this gas is usually colorless, odorless, and tasteless. So it is similar to the common gases, other common gases used in diving, such as oxygen, nitrogen, and helium. So gas is commonly emitted from gasoline-powered vehicles and from any other industrial internal combustion engines which are fueled by petroleum. So, and even when wood is burnt at some of your wet kitchens at home, carbon dioxide will be emitted. So if we look at how divers are exposed to this poisonous gas, as you may know, majority of the air cylinders which are used by divers in their scuba sets consist of normal compressed air. And these cylinders are charged at the diving facility using air compressors, which are mostly, uh, run using gasoline engines. So there's a possibility of contamination of exhaust gas which contains carbon monoxide if the inlet valve is placed close to the exhaust. So also the atmospheric air around the air compressor is what compressed into the scuba sets. And the quality of the air or the percentage of carbon monoxide around you is directly responsible for air you breathe when diving. So furthermore, sometimes when there are malfunctions of these air compressors, these air compressors could get hot enough to partially combust those lubricating oils which are used to, the lubricate the air valves, and it also can produce carbon monoxide. So those are the main ways how a diver is exposed to dangerous amounts of carbon monoxide. So to tell you, as I told you, the cases are underreported as it may mimic decompression sickness and respond to the same treatment. So these symptoms of this carbon monoxide poisoning is more or less similar to decompression sickness, and the treatment is also more or less the same. So if you see a case report quickly, a 25-year-old diver was working in dock using an airline from a surface compressor. As is standard practice, the air inlet was situated upwind of the compressor to prevent air contamination with exhaust fumes. Having dived to 10 meters for 30 minutes, he completed his task and ascended. But on surfacing, he was seen by his colleagues to be confused with possibly a brief loss of consciousness He had difficulty returning to the quayside where he needed help removing his equipment and was noted to be coughing, disoriented, and weak. So on arrival at the A&E department, he was alert and oriented, but complaining of nausea and headache. Examination was unremarkable. So tachycardia was there, and the ECG showed sinus tachycardia, and the carboxyhemoglobin level was 37. Oxygen was so immediately commenced. So these are the usual symptoms of a mild to moderate carbon monoxide poisoning. But in severe case, there are severe symptoms, and I will be talking about those symptoms in the further slides. So if we uh, talk a little bit about the chemistry of carbon monoxide, usual concentration in natural air is 0.1, and household it can be about 0.5 to 5 parts per million volume. And if there's wood fire in the house, it can be high as 5,000. So smoke from internal combustion engine, it can be higher as 10,000 to 30,000 ppmv, which is extremely dangerous because the toxic level of carbon monoxide in air is above 35 ppmv. And OSHA regulation for long-term workplace exposure should be less than 50. So this OSHA means the Occupational Safety and Health Administration USA. So they have set a limited, a certain point where if the carbon monoxide is more than 50 ppmv in your air, it is dangerous. So there are actually equipments to measure the carbon monoxide or the quality of the air around you. I mean, in Sri Lanka as well, by the Central Environmental Agency, they measure the quality of the air time to time, and in different districts, and they actually upload it in the internet. If you go to their website, you can see, district wise they upload the quality of the air. Also sometimes they put the ppmv value of carbon monoxide on air. So there are equipments to measure that. So if we talk a bit about, I mean, the pathogenesis of carbon monoxide poisoning. So now, as you can see, the affinity of carbon monoxide to hemoglobin is 240 times more than that of oxygen. So it combines with hemoglobin rapidly than oxygen and produce carboxyhemoglobin. So it will cause, ineffective oxygenation, which will lead to tissue hypoxia and subsequently death. So the level of carbon monoxide concentration of 667, in air will cause a carboxyhemoglobin level of 50% in a person. So that can directly lead to seizure, coma, and death. And the pathogenesis continued. Premature release of oxygen prior to reaching the distal tissue by carbon monoxide leads to hypoxia at cellular level. And also the inflammatory response is initiated due to poor and inadequate tissue perfusion. And also there is, you can get myocardial depression from carbon monoxide exposure. Also, it can cause dysarrhythmias, myocardial ischemia, and myocardial infarction as well. And to tell you, there are numerous case studies describe disruption of repolarization and prolongation of QT interval. I mean, as the cause for these dysarrhythmias, but yet the exact mechanism is not known. So if we talk about clinical features, so the clinical features are based on the severity, and the severity depends on the percentages of carboxyhemoglobin in blood. So if you take acute poisoning, the mild severity. So the mild severity is about less than 30% of carboxyhemoglobin. So you will get symptoms like headache, nausea, vomiting, dizziness, exertional dyspnea. Like the symptoms, the diver who was in that, I mean, case report, the diver who got the symptoms are similar to mild severity of acute poisoning. So in moderate poisoning, the patient will get, chest pain, blood vision, confusion, weakness of your limbs, increased dyspnea, will be tachypneic, and tachycardia you can get. And in severe cases, there will be trismus, muscle spasms. You can even get convulsions, palpitation. And as I told you, there will be ventricular arrhythmias if you take ECG. But also it can cause myocardial infarction and respiratory failure as well. So in chronic poisoning, like, I mean, if you are exposed to more than 50 ppmv of carbon monoxide for a long-term duration, these symptoms, you will develop headache, dizziness, weakness, nausea, vomiting, visual disturbances, deteriorated skins, these kind of symptoms. So the diagnosis of carbon monoxide can be directly done by estimation of carboxyhemoglobin level, but unfortunately, it's not available in Sri Lanka. As far as I know, I have checked from MRI and other labs as well. But you can come to the diagnosis using the other methods, like you can use pulse oximetry, arterial blood gases, ECG, chest X-ray, and the clinical history and examination. It will directly leads you to diagnose carbon monoxide poisoning. So this chest X-ray, you can take in chest X-ray in patients with significant intoxication, and the patients with pulmonary symptoms and evidence of hypoxia. So usually findings are normal, but changes such as ground glass appearance in the X-ray or perihilar haze or intraalveolar edema, it implies a worse prognosis, right? So if you go to management, what we have to do is immediately remove the patient from the contaminated environment and apply 100% oxygen. So that is the immediate thing you can do. And if the patient is comatose, you can use, like you can intubate the patient and give oxygen, and you support your treatment for cerebral edema, acid-base balance, and you can avoid physical exertion for the patient. So in definitive management, as I told you, we use hyperbaric oxygen therapy. But in this here, you can see that if we can measure the carboxyhemoglobin level, we can directly choose whether to go to hyperbaric oxygen therapy or to treat with normobaric oxygen. But as I told you, measuring carboxyhemoglobin level is not available in Sri Lanka. So what we can do is, like, we can use the symptoms and assess the severity of the patient, whether this is a mild or a moderate or severe case. So from that, we can come to an idea the amount of carboxyhemoglobin in the body. So by using that, we can choose hyperbaric oxygen therapy or normobaric oxygen therapy. So as an example, if the hyperbaric facility is close by, if the carboxyhemoglobin is more than 25, that means if you have symptoms of moderate severity, or I mean, like mild to moderate severity, you give hyperbaric oxygen therapy. And if the carboxyhemoglobin is less than 25, if there is symptoms, you can still give hyperbaric oxygen. And if there's no symptom, you can give normobaric oxygen therapy. So if we talk briefly about the rationale of hyperbaric oxygen therapy in carbon monoxide poisoning, so what happens here is there's immediate saturation of plasma with enough oxygen to sustain life. Now, because he's hypoxic, there will be enough oxygen for him to breathe. and it causes a rapid reduction of carbon monoxide in the blood by mass action of oxygen. As you can see in this equation, if you increase oxygen, carbon monoxide will reduce, right? And it also hyperbaric oxygen also reduce cerebral edema, and brain lipid peroxidation caused by carbon monoxide is prevented by 100% oxygen at 380. So those are facts which are available, right? And also hyperbaric oxygen prevents immune mediated delayed neurologic dysfunction following exposure. So the most common protocol we use to treat is initial 45 minutes of 100% oxygen at 380 A. So you put the patient into chamber, you increase up to 380 A. That's about 20 meters inside the chamber, and you give 100% oxygen with breaks like 45 you in for 45 minutes continuous. You don't give oxygen, you give 5 minutes break. And also you can use US Navy table 5 or 6 depending on severity of the and the improvement of the patient. So the prevention is the most important part. Now, as you all know, what the oxygen cylinders are, I mean, the scuba set cylinders are filled with normal air around you. So regular assessment of the quality of the air around you will lead to good quality of air inside your cylinders. So you can, as I told you, you can do by measurements. And also there are equipments to assess the quality of the air which is filled in the cylinder. So if you go for diving to I mean like even a commercial diving place, you can ask them whether there are like certificates available or whether there are like equipments available to measure the quality of the air inside the cylinders. And as I told you, you can check for air compressor safety certificates with those diving providers. And when doing deeper dives, you can use pure gas cylinders. Like there are pure gas cylinders available, oxygen, nitrogen, helium, 100%, those things. So if you use those, there is very less chance that you can get carbon monoxide poisoning when you're diving. What you mean by deeper dives is when you're diving deep, even a carbon monoxide of very minute partial pressure on the surface will be very dangerous when you go deep, because the partial pressure increase with the pressure, right? So there's a simple method. You can breathe from cylinders for about 10 minutes before diving. Sometimes people do that. You check whether you get symptoms like headache, so that means there's a bit of carbon monoxide is I mean little bit high, so you don't go for dive like that. And you can't do anything, or you don't have any equipments. What you have to do, simply you go to a place where the diving is available in a good environment. I mean like where it is not urbanized. I mean Trincomalee is better than Nigambo, like urban areas, right? So these are the references I used for making this presentation. Thank you.